Attention Deficit Hyperactivity Disorder, or ADHD, is one of the most common mental disorders for children, and it can present some very big challenges. But a new study reports that problems don't end when kids with ADHD grow up. Psychiatry professor Russel Barkley is the author of the study. Professor, good morning.
Good morning.
First of all, let's talk about what causes it. 7% of all children and 4.5% of all adults have this disorder, and you think the cause is genetic?
Well, there are many causes for ADHD, but all of the known causes at the moment fall in the realm of biology, particularly genetics and brain difficulties. But about 80% of the disorder appears to run in families and be highly genetic.
And you followed a group of young people, starting from the 1970s, who had this disorder, and you followed them all the way up to today. And you found that the symptoms carry through to adulthood?
Yes, ma'am, we did. We found in Milwaukee with my colleague, Dr. Mary Ellen Fisher, that following these children for a period of about 15 years or more, that they had great difficulties in adulthood in a variety of areas of major life activities, such as school and social relationships.
So looking at the adult symptoms of ADHD, you have, if you have problems managing time, keeping a job, with relationships, managing money, with driving, these are all symptoms of possibly having adult ADHD, and you say these are manageable, that these problems can be managed. Is that right?
That's correct. That all of these major life activities in which they are showing impairment are preventable harms if we can get in early with a package of treatments that we know will help them and try to sustain that treatment over time.
Well, let's talk about those treatments, because you actually say that the treatments have to start very early in childhood, and if the treatments don't start early, there can be some very dire consequences, including that young people who were diagnosed but not treated were more likely to quit school because ADHD makes it difficult for young people to learn.
Yes, that's correct. These children are very impulsive, they're very distractible and inattentive, they have significant problems with hyperactivity and restlessness, and at the core of their disorder there's a major problem with self-regulation, with self-control, and this leads them to have a great deal of difficulty in school, where there's a lot of demands on restraint and willpower and being able to persist at your work.
Now, on that point then, because ADHD kids are more likely, you say, to shun contraceptives and then more likely to become parents earlier than their peers. Why is that? Is that because of what you just said, the difficulty to control your behavior?
Well, that's correct. We did find that about 32% of them or more actually had been involved with a teen pregnancy as the mother or father. And we found that about only 1 out of every 25 of our control children had difficulties in this area. And the problem stems from not using contraception, from being very careless and risk-taking, and not putting a lot of forethought into your behavior, which leads them, of course, because of their impulsiveness, to do these sorts of things.
And as adults, they're more inclined to be fired from their jobs, and less than half of the savings of savings of other young adults that they would have grown up with. So really what we're really saying here is that there are a number of reasons to get in there and get treatment early. I guess the question for anybody who's concerned about having a child with ADHD or has it themselves is, will the treatment make a difference? And what did you find there?
Well, what we have found is that if treatment is started early and it is sustained over years of time, these individuals can lead relatively normal lives. But we also found that if they're not treated, there are risks in virtually every area of major life activity in which adults carry responsibilities.
So this is this is a warning call to parents to look for these particular symptoms in their children, to make sure their children doesn't have this disorder. If your child has difficulty controlling him or herself, needs constant monitoring, and does not have friends, then these are clear signs that you might want to go in and talk to your doctor to make sure that your child does not have ADHD. Professor Russel Barkley, thank you so much for this important information to help our families this morning.